When I found out I was pregnant, it was a bit of disbelief, to be honest. I think that neither my husband nor myself expected that it would be so quick. We sort of had planned that it would probably be some months down the line. So I actually didn't realise I was pregnant until I was 7 weeks pregnant. We're very excited, but equally a bit daunted that it was happening. I had quite a lot of concerns during the pregnancy. How much of that was perfectly normal concerns that anyone would have in pregnancy, and how much of that was down to my disease, I'm not sure. I think it was probably half and half. I did ultimately end up having regular scans, so I had them every 4 weeks, and that sort of did a lot for just putting my mind at ease. Normally about 3 weeks after the scan I would start to get anxious again, I would start to get nervous, and then I would know that I was having another scan, and then everything was fine. The main challenges in pregnancy were probably worrying that my disease would flare, or also that my disease would flare post-pregnancy, because albeit it was sort of still a while away, that was in the back of my mind. Another worry was, again, the fact that I was on medication throughout, and the worry that possibly the baby could be immune suppressed, which was one of the theories with taking anti-TNF. I think that my disease probably did have quite a bit of an effect on my enjoyment of the pregnancy. I say that it made it difficult to sort of relax, but I did, towards the end of the pregnancy, really start to enjoy it and start to relax, and I did feel a lot happier. But I think there was still that in the back of my mind of what if something goes wrong. So I think it did it probably did stop me enjoying it fully, but whether I would feel the same had I not had the disease, I don't know. Part of pregnancy that I enjoyed the most was when I actually started to look pregnant, and when I started to feel well, and when the baby started to move. That was really exciting. And I think every day your body just changes and something else happens, and I think just the whole thing's quite amazing that there's another person growing inside you. So yeah, I think that was sort of probably one of the best bits. In terms of how my disease might impact my pregnancy, I had a lot of information on the medication, as much as they had. I was led to believe that it's less likely that you'll flare during pregnancy, just due to your immune system already being suppressed, to stop obviously the body rejecting the baby. The information about my treatment during pregnancy, I was given information that I could have steroids should I flare, so I knew that there was that option. I wasn't going to be sort of stuck. The hospital made it very clear that they could be contacted at any time, and if I had any questions I was able to phone them and ask. During my pregnancy, in terms of additional questions that I might have had, it was probably all related to the anti-TNF and whether the baby would be immune suppressed and what I could do, and whether I should stop it or whether I should continue. And I felt that my doctors listened and they were interested. My doctors were all very relaxed, which I suppose probably helped me quite a lot. But certainly my obstetrician was just, nothing was a problem. It was all perfectly normal, and my pregnancy was very straightforward. There weren't any concerns throughout it, so he was very relaxed that everything was going to be as a normal pregnancy would be for anyone else. The different specialties that I saw in pregnancy were, I saw my rheumatologist, I saw my rheumatology specialist nurse, and I saw an obstetrician as well as midwives. The rheumatology staff were obviously far more knowledgeable on the medications that I was on. The obstetric staff tended to be more just about the pregnancy itself and the delivery and how everything was going to go from that aspect. But if I had anything specifically related to my disease itself and the medication interactions, I would go to the rheumatology team. My disease stayed stable throughout the first part of my pregnancy. I flared in the second trimester, which was possibly down to the fact I'd had to stop my anti-TNF for an infection, or possibly down to pregnancy. I don't know which one it was that caused that. However, I went back onto that and was able to stay on that until I was 35 weeks pregnant. And initially the plan before getting pregnant was that I would stay on it until the second trimester and then come off. Because I'd flared in the second trimester, it changed, and I stayed on the anti-TNF until I was 35 weeks pregnant. At 35 weeks, we discovered that our baby was breech. So it was very likely I was going to have a C-section.